Welcome back to Align Chiropractic Center's YouTube page. I'm Dr. Mike. Today we're going to be talking about everybody's favorite word, sciatica. Every single week somebody comes in, my sciatica, my sciatica. What is sciatica? Most people have no idea. People come in and see me, they point to their pain, they tell me it's up here, they have sciatica. It's not sciatica. What sciatica is an inflammation of the sciatic nerve, which could be caused by multiple different things. The sciatic nerve starts from the lower back, runs through the pelvis, through the buttocks, and all the way down the legs into the feet. So if you have compression or irritation or inflammation anywhere along that nerve, that can give you that zinging down the leg, that pain, tingling, and numbness from the low back through the glutes all the way down the leg. Why does everybody think they have sciatica? I have no idea. It's a funny word. It stands out. I have no idea. But every week someone comes in thinking that they have sciatica. So what are some common causes of sciatica? Well, when we look into this lower back region, this is the area that when we sit, we put most of our weight and pressure. Right now, even me sitting with good posture here, I'm putting most of my weight and pressure into this lower back area. That puts a lot of pressure on the joints and the discs. If we don't take care of ourselves as we age, those disc spaces get smaller and smaller. That's kind of what I got in these models right here. As these disc spaces shrink, those spaces don't grow back. So what happens is you can irritate and compress these nerves that sit in the side just like that. Now, if you are sitting constantly at a desk over and over and over again, driving, flying, you are putting so much weight and pressure down low there, eventually those joints are going to get fixated and locked up and they're not going to move properly. Then when you go to bend and reach behind the car, all of a sudden the joint doesn't move with you and now you can start irritating that nerve. Once that nerve gets inflamed, it can be complicated to get that inflammation to quiet down. It's the thickest nerve in the body, so once it gets inflamed, it can be much more challenging. So those are some reasons why I think it's such a common issue. Another very common issue associated with sciatica is weight gain. If you are overweight, you're putting additional pressure and stress in this lower back region, whether you're sitting with good posture, whether you're moving properly. So additional weight is actually going to work against you in that circumstance. Now, another common issue that we see is disc herniations. So sometimes these discs can compress and wear out. We call that degeneration. But a herniation is actually where the inside jelly material, the squishy material that cushions our bones, pushes backwards, and that can start pressing on the nerve. That can happen from a car accident. It could happen from bending improperly, heavy weightlifting, helping your friend move. There's a lot of different things that could cause that, but you can have intense pain with a disc herniation. And those are also slower healing issues to have come about. So if you think that you have any one of these issues going on, what should you do about it? You want to go get an exam and a consultation because whether it's a medical doctor or a chiropractor or a physical therapist, they should have a pretty good idea just by taking a good thorough history whether you have sciatica or not. Now, there still may be some questions, so you'd want a physical exam as well. Doing some range of motion techniques, some orthopedic exams are going to help that doctor identify that. And then you may want an x-ray as well. Now, an x-ray is not going to show you the discs or all of the nerves and things like that. So if it's a really severe situation, you will also want to get an MRI. But before you go rush and get an MRI, you're going to want to see a doctor. In my opinion, a chiropractor is best for something like sciatica because we're dealing with it on a daily basis. And we can also refer out for some of the advanced imaging as necessary. In a lot of situations, people come to me hunched over, they can't bend, they can't straight up, they can't sit, and we're able to do some techniques to get them back feeling better, moving better, and they actually a lot of times end up canceling their MRI appointments because we start the healing process right away. If you think you ever have sciatica or a disc injury, the longer that you wait, the harder it is to fix. Check out our page, come see. We're trying to educate you guys as much as we can to help get you the information so you know what to do if you have any problems.